Hello everyone, welcome to Pharmacology Shorts. This is Dr. Shubham. I will be talking about the class 2 antiarrhythmic agents in the video lecture series on anti-arrhythmia. So I will be talking about the beta blocker action, particularly in arrhythmic agents. So before understanding what the beta blocker action is, let's understand the action potential in the nodal tissues, which is the SA node and the AV node. So what is happening here? This is the phase 4 of the depolarization. This is phase 0 of the depolarization and this is phase 3 of the depolarization. What will happen in the phase 4? There is slow influx of the sodium ions which will cause slow depolarization, and then there is phase 0 which is the rapid influx of the calcium ions which will cause rapid depolarization, and then comes the phase 3 where there is outflux of the potassium ions which will cause the repolarization phase. So this is what happening in the nodal tissue. Coming to the normal beta actions. What is a beta receptor stimulation? What does it do? It will increase the automaticity of the heart and it will increase the AV conduction velocity. So whatever wave which is starting in the SA node, it will rapidly pass through the AV node and it will rapidly cross the Purkinje fiber and cause contraction of the ventricles, and it will even decrease the refractory period. So to better understand this, as you all know, beta receptor stimulation means sympathetic stimulation. So this dotted line is actually the AV nodal action potential. So when there is sympathetic stimulation, as you can see, there is increased automaticity and increased AV conduction. So there is a decrease in the refractory period, and there is a decrease in the AV conduction time. And coming to the vagal stimulation, there is increase in the AV conduction time. So beta adrenergic blocker, they will competitively block the catecholamine induced stimulation of the cardiac beta receptors. So this is the most important mechanism of action. Coming to the beta blockers, whenever we hear this name, first thing we remember is propranolol. So what is the action of the propranolol? It will diminish the phase 4 of the depolarization. What is phase 4? As you just now discussed, this part is the phase 4. As you can see below this line, this is the phase 4. It will diminish the phase 4 depolarization. This dotted line is the beta blocker action. So you can see the phase 4 is depressed. Due to this, there is depressed automaticity and there is negative inotropic effect. What is negative inotropic effect? There will be heart rate, cardiac output, and cardiac automaticity will be decreased. Due to all these things, there will be prolonged AV conduction and prolonged action potential duration. See, this is the normal action potential duration for this AV node. But when the beta blocker action is there, this action potential duration will be increased from this point to this point. So as you can see, the action potential duration is increased. As it is decreasing the heart load, so it will reduce the myocardial oxygen demand, and it is well tolerated and a safer drug. So what is this action on the ECG? As you can all see, this PR interval, it signifies the AV conduction, which means the wave is going from atria to the ventricles. So as the AV conduction time is increased, so there will be prolongation of this PR interval in the ECG. Coming to the beta stimulation and beta blocker differences. Stimulation, it will increase the magnitude of calcium current and slows its inactivation. But whereas beta blocker, it will inhibit everything and decrease the intracellular calcium overload. So, and this stimulation, it will increase the pacemaker current and it will increase the heart rate, which all will be decreased by the beta blocker. And the after depolarization arrhythmias are very common with beta adrenergic stimulation, whereas in beta blocker, as the refractory period is prolonged, so it will inhibit the after depolarizations. And epinephrine, it induces the hypokalemia, which is a beta 2 action, whereas propranolol, it will inhibit and block this. So now coming to the uses in the arrhythmias. As you have all seen now, according to the mechanism of action, we all have understood that there is AV nodal delay. So what will happen? It will control the supraventricular arrhythmias like atrial flutter, fibrillation, and the PSVT. And it is even used to treat tachyarrhythmias, which is caused by the adrenergic stimulation, like in cases like hyperthyroidism, pheochromocytoma, and even during anesthesia with the halothane. And as it is used during anesthesia, so it is used in emergency purposes too. Digitalis induced tachyarrhythmias, and even in prophylactic in post-MI. It even reduces ventricular arrhythmias in the prolonged QT syndrome. What is QT syndrome prolonged? Which means Torsades de Pointes. So it is used in Torsades de Pointes. Now coming to the other drugs like esmolol and sotalol. Esmolol, it is particularly beta 1 selective agent and it is having very short elimination T half, which is only 9 minutes. So it is used in conditions where we need rapid action, and it is metabolized by the RBC esterases, and it causes rate control of rapidly conducted atrial flutter. Its uses are in arrhythmia associated with the anesthesia, so it is used in emergency purposes, and the supraventricular tachycardia. Coming to the sotalol. What is sotalol? It is a non-selective beta blocker, and apart from beta blocking action, it is having potassium channel blocking action too. So it is contraindicated in patients with the long QT interval, which means torsades T pointes. Why? Because it also prolongs action potential duration and the QT interval. So its uses are polymorphic ventricular tachycardia, and it maintains the sinus rhythm in atrial flutter and atrial fibrillation. This is the most important point. It is having both anti-arrhythmic and pro-arrhythmic action, which means it even treats arrhythmia and even it causes arrhythmia too because of prolongation of the QT interval. Thank you. Please like, share and subscribe.